Hi, my name is Mary Kate O'Riordan, and I am a senior dietetics major and business administration minor at the University of Delaware. I will be graduating this May. A situation in which I took initiative was during my study abroad experience in Australia. I was part of a group of students who's assigned a project analyzing vulnerable populations. We chose the Australian Aboriginal population, who has a very high prevalence of diabetes. I recognized that the project could be enhanced by interviewing the Aborigines in a clinical setting. I took the initiative and made the suggestion to visit an Aboriginal health clinic and speak to the patients and staff. My group members were hesitant to interface with these misunderstood and unique people. However, I stepped up, identified a clinic, and organized a visit with my group. I initiated conversations with the patients and medical staff. My group was soon to follow. The entire group of students were happy and enriched after our experience. A time in which I had to build rapport was in the summer of 2015. I took a job working at Pennsylvania Hospital in their kitchen and unknowingly immersing myself in an environment that presented an opportunity for some self-growth. I was the sole college student raised in the suburbs, working side by side with a team of people from different ethnic backgrounds who were raised in the traditional urban environment. I was planning a future as a dietitian, bachelor's degree, master's degree, and a potential range of job opportunities. Many of my coworkers have spent their career working in the hospital's kitchen. My boss, Miss Aldine, was a stern woman in her early 60s who had risen from an entry-level food service job to the manager of the entire kitchen. She addressed everyone, including myself, with an uncompromising harsh tone. It was kind of my way or the highway. I worked hard, treated her and my coworkers with respect, followed directions, was prompt, and over time, I saw a different side to Miss Aldine. She was no nonsense, but her intent was to lead the staff to achieve the goal of providing high quality food services to the patients. I was less afraid of my authoritarian boss as the summer progressed, and I recognized she was harnessing her innate skills to meet her responsibilities. I felt I had crossed cultural and age barriers to develop healthy relationships with my coworkers and supervisor in this often forgotten department of any hospital. Characteristics that ARAMARK possesses that led me to apply include that ARAMARK is one of the world's most admired companies and is known to be supportive of its employees. I personally know that ARAMARK has a great reputation from working at Moss Rehab this summer. ARAMARK's history is also inspiring, growing from one man selling peanuts out of his car to an international provider that services millions of people. Sets standards for food services, has a wide spectrum of opportunities, and a large network. It's also well known that ARAMARK is one of the nation's largest employers of RDs. Professional strengths that I possess that make me a great fit for ARAMARK is that I have executive skills. I'm an organizer and I am a self-starter. Factors that I considered when choosing ARAMARK Philadelphia location was family. Family and the Philadelphia environment. I was born and raised here and it's a great city.